So today we're going to be talking about how to do all the maintenance on our CBC machine. So the first thing we do every day is we turn it on and we run a blink. And once the blink is done running, we look over the results and make sure the machine is good to go. We also do weekly, monthly, and every 6 months or so we also do maintenance. So our weekly maintenance that we're going to do is just kind of wipe down our machine with a non-bleach product. We just want to make sure there's no dust and all of it's lint-free, hair-free, to make sure everything's running properly. We're also going to clean our keyboard with the can of air that you just spray on the keyboard to make sure there's no dust and everything on that as well. What we're also going to do monthly is we run a prime and a clean cycle. This is just to make sure everything works well and all of our results come out as needed. The machine will ask you to do an enzymatic cleaner monthly or as needed. So the more tests you run, about every 100 tests or so, it will ask you to run your enzymatic cleaner. That's this cleaner that we have that we put in our EDTA or our purple top tube, and you put about 0.3 mils in it and run that, and that just makes sure the machine is running properly and all your test results are what you need them to be and running normally. And then there's also 6-month maintenance. So every 6 months we will have to change the reagent pack, or the more tests you run, just like the enzymatic cleaner, you may have to change your pack more often. When you do change your pack, you need to make sure you do change all the reagents and not just some of them. And then you also need to run a prime cycle to make sure all your quality controls are correct. And then you can also run a blood sample to make sure results come out as a test run. So I'm going to show you where our reagent pack is. We keep ours underneath this cabinet. It's just down here in this box, and this is what you'll change every 6 months. So that kind of sums up all of our maintenance on our CBC machine. So today we're going to be doing a pancreatitis snap test or CPLI test on a dog that hasn't been eating and not drinking and shaking for about a day and a half. So the first thing we need to get is blood off the dog, and then we're going to take 3 drops of this blood. You put 3 drops into the tube. 1, 2, 3. And then you use 4 drops of the conjugate. 2, 3, 4. And the next thing you're going to do is invert the tube 3 to 5 times to mix the blood and the conjugate together. And then next what you do is you pour the whole tube onto this section of the snap test. And then what we're going to do is we're going to wait until the blood and the conjugate reach down to this part of the snap test, and then we will snap it. Once it reaches the bottom part and you snap it, you will wait 10 minutes for the test results, and then you will check to see if it's going to be a positive or a negative. All right, before we snap it, we're going to move it right over here. Now we are going to snap it. So our pancreatitis test is done running. It's been 10 minutes. So when you look at the test, we'll do a close-up now. The dot on the left side, the darker dot, shows that the test is normal, and the other dot is a lighter color, so that means that it's normal. If it was abnormal, the other dot would be a darker color, so our patient does not have pancreatitis. So today we're going to be doing the modified knots test. So the materials that you need are your blood sample. You're going to need 1 ml of your blood sample. You're going to need a pipette, your syringe, a slide and cover slip, and you need your 9 mils of your 2% formalin, and you also need a balance for your centrifuge, and it's just with water. So I already have my 2% formalin made, so the first thing I'm going to do is add 1 ml of my blood to my formalin, and then we will centrifuge it for 5 minutes. So once you get your sample, you're just going to place it into the tube with your formalin. Then you place the cap. Then you're just going to invert gently to mix the formalin with the blood. And then we're going to place it into the centrifuge. And we're going to spin it at a speed of 15 for 5 minutes. So once our mixture is done spinning for 5 minutes, we're going to decant the supernatant. So what we're going to do is, we're not just going to pour it into the sink because it has the formalin in it. So we're just going to pour it into another tube and we will dispose of it properly later. You want to make sure not to disturb the pellet at the bottom. So once you have that all poured out, the next thing you're going to do is add 1 drop of the methylene blue to your sample, and then you're going to mix it gently with a pipette. So once it's done mixing, you just need 1 drop on your slide. And then you're going to place a cover slip. And we're going to start by looking at on our 10x power, and we're going to be looking for our microfilariae. So we're going to scan our slide and look at it. Okay, so once we've finished scanning our whole slide, you will find your results. So our results for this blood sample in this patient is negative, so there's no microfilariae on this blood sample, and that is how you do a modified Knots test. So today we're going to talk about the 4 different types of fecal methods and the differences. So there's a direct smear, a fecal flotation with centrifuge, and a fecal sedimentation. So a direct smear is when you only have a small amount of a fecal sample, and then you also may miss some of the parasites when you do it. It's also the easiest and simplest form to do when you're doing a fecal. Your next one is going to be a fecal flotation. This one takes the most amount of time, so it's not recommended. And there's also the fecal flotation with a centrifuge. This is the most common one that we do all the time. The parasites float to the top and you get to catch almost all the parasites on there, and it shows more parasites as well as cysts. And then our last one is a fecal sedimentation. This one also takes a very long time and is not a really common form of fecal to test for fecal parasites. And with this one, you may actually miss some of the parasites, but most of the time we only do this one if you're looking for a fluke infestation. So today I'm going to show you how to do a fecal flotation. So the first thing you're going to need is some gloves and a fecal sample, which we have right here. We have a 2-gram sample. So the other things you're going to need is a cup to mix your fecal solution and your fecal sample, a tongue depressor to mix it with, and a tube to let the fecal sample sit with the cover slip so then you can read to see if it has any parasites. So the first thing you're going to do is put some of the fecal flotation in the cup. And then you're going to get some of your fecal sample. I'm going to use the tongue depressor to get it out. And then you're going to mix it until it's very well mixed together. So once this is all mixed together, you're going to strain the solution because you don't want the large chunks of fecal matter in your sedimentation area. So you're going to put your test tube in your holder, and then you're going to use a piece of gauze to filter out the fecal solution that you made. So now what you're going to do is slowly pour this into the tube and let it filter itself. You're going to fill the rest of the solution up with the fecal until it forms a meniscus at the top. Then you're going to place a cover slip right on top. And then you're going to let it sit for 10 to 15 minutes. So the 10 to 15 minutes has passed waiting for the flotation. So now you just need a slide, and you're going to remove your cover slip, place it on the center of the slide, and then you place it on the microscope to read. We always read on 10x power for the microscopes, not the oil lens. You can also use 10x if needed for the smaller parasites, but now we're going to read it and check for parasites. So today we're going to learn how to do a fecal flotation but with using a centrifuge. So the first thing you need is your fecal sample. You need about 2 grams of it. You're going to have your cup with the fecal solution already in it, your tube, tongue depressor, gloves, and your gauze to strain the solution. So the first thing you're going to do is take the fecal sample and you're going to add it to the fecal solution, and you're going to mix it to make a homogeneous mixture. At the top. We do have a fecal centrifuge, so what I'm going to do now is place this into the centrifuge. And what we do is we're going to use the rest of the fecal flotation to make a meniscus. And then we're going to grab our cover slip. You place that on top of the meniscus. And then you need to balance your centrifuge out, so we have another tube filled with plain water to balance this out so it can spin. And then we're going to spin it down to the speed at 13 and for 6 minutes. And then afterwards we will pull it out, let it sit for 10 to 15 minutes, and then take it off and place the cover slip on a slide and then read in the microscope to check for parasites. So now that the 10 to 15 minutes has passed and the centrifuge has completed spinning, we left it in here. So now we're going to remove our sample. We're going to set it back into our holder. And then you need to get a slide, and you take your cover slip off, place it on the slide, and then you can use the microscope to check for the parasites. And you use the 10x power to check for the parasites. You can also use the 40x, but we do not use any of the other lenses on the microscope. So now we're going to learn how to do a direct smear with a fecal sample. So the first thing you're going to need is your fecal flotation, your fecal sample, a wooden applicator, gloves, a slide, and a cover slip. So the first thing you do is you take your fecal flotation and you're going to add several drops onto our slide. And then now what you're going to do is you can set this down. You're going to get your fecal sample, and you get about the same amount on your applicator as you put on the slide, the fecal solution. So now what you do, you hold your slide, and you're going to mix your fecal sample with your fecal flotation. And you want to mix it to get a homogeneous solution. Once you get it mixed very well, you thin it out and you remove any large pieces of fecal matter left. You want it to be thin enough to where the cover slip fits on top of it so you can read your slides, so you can check for parasites and things like that. Make sure all the thick portions are off. Alright, once you have it thinned out, you just take your cover slip, place it on your slide, and then you can place it on the microscope to read to see for any parasites. So we're going to do a fecal sedimentation today. So what you're going to need is your fecal sample, a tongue depressor, your cup, your gauze to strain your solution after you mix it, and your tube to centrifuge. So all you need for this is some tap water. So we're going to add some to the cup. And then we're going to get about 2 grams of our fecal sample. This one you will not be forming a meniscus on, so you fill it all the way, place it in the centrifuge. Make sure you have one on the other side filled with water to balance your centrifuge, and we're going to spin it on a speed of 13 for 5 minutes. So the 5 minutes have passed for the centrifuge of the fecal sample that we're running. So what I'm going to do is get the fecal sample out. So you can see at the bottom of this sample there is the sediment at the very bottom. So what I'm going to do is to remove all the liquid off the top of this sample. We only need the sediment for the slide to read to just check and see if they have any parasites. So you remove all of the liquid off, and then you just take the top layer of the sediment and add a sample of that onto the slide. So what I'm doing is just pipetting the liquid off. You can pour it if you want, or you can use a pipette. So now once you have all the liquid off, you can take a pipette and you're going to pipette the sediment, the first layer of the sediment off. And then you're going to place it on a slide. And then you add a cover slip. And then you place it on the microscope to read and check for any parasites. So today I'm going to talk about the 3 different types of urine collection methods. So the first one we have is our cystocentesis. That's when you use a needle and you directly insert the needle into the bladder with the patient in lateral, standing, or ventral dorsal. That is the most sterile way to collect urine. Later on we'll do a video on showing how to do that. Our next one is going to be putting a catheter straight into the bladder. You can do it that way as well. Most of the time it's difficult if the patient isn't under sedation or anesthesia. So we don't normally do that, but when you do need to get rid of the first few milliliters of urine because that is contaminated urine, and then you can get sterile urine from that. And the last one is a free catch method. That one is the easiest to do, but it is also one that's going to be contaminated the most. You need to make sure you've got something sterile to collect it with, a sterile container to put it in, and you also need to understand you're probably going to have a high white blood cell count in the urine you catch you get free catch just because it is going to be the most contaminated when you do that. When you do a free catch, you want to let the dog urinate for a little bit and then catch midstream and then let them finish urinating. So you try to collect the most sterile portion of their urine, and those are the 3 methods of urine collection. Okay, so today we're going to be filming a free catch urine on our patient Reggie. So what you do is you wait for him to find a spot to go to the restroom, and then midstream you catch your sample with something to catch. We use a ladle here, and that is how we free catch urine. So today we're going to be doing a cystocentesis on Teddy. So the first thing we're going to do is the doctor's going to palpate through the bladder, and then once she finds it, she's going to spray some alcohol on it to part the hair, and then she's going to use a syringe with a needle on it, and she's going to place the syringe into the abdomen to inject into the bladder. And then once she fills the bladder, she's make sure she's not going to direct the needle because you can damage the organs internally. So the doctor is going to insert the needle, and she's going to make sure not to direct the needle anywhere except into the bladder. And then she's going to remove the urine from the bladder. And then we're going to hold off. So today we're going to be placing a urinary catheter in our patient. So the things you're going to need is your patient laying in lateral redundancy. You're going to need your sterile syringe. We're going to use a 12 ml syringe. We have our sterile urinary catheter, our sterile lube, gauze, and our sterile saline to wash the penis off. So our doctor is going to handle all of the sterile stuff. That way everything stays sterile and clean. What she's going to do first is we're going to extrude the penis and going to clean it with sterile saline. And then we will put the catheter in and get the urine. Okay, so now we're going to start the process of putting a urinary catheter in. So the first thing she's going to do is extrude the penis. Yep. The next thing we're going to do is rinse the penis with our sterile saline to make sure everything is sterile. Okay, and next she's going to make sure our catheter is the correct size, and she's going to put sterile lube on the end of the catheter, and then she will insert the catheter into the external urethral orifice of the patient, and then we're going to extend it into the lumen part of the bladder. And once we get into the bladder, we're going to discard the first ml or two of the urine, and then we will collect the rest of the urine, because the first few mils we will discard for less contamination. Okay, so we are going to remove the urine. Discard the first few milliliters, and then we will get the rest to use for our sample. And then what we will do next is we will place the urine into our container to send off for your noses. So today we have a dog here that's presenting with an ear infection. So we are going to get an ear cytology and then read the ear cytology to see what kind of infection she has. So the first thing you need are cotton tip applicators. So you need two of those, one for the left and one for the right, and you need a slide. So what I'm going to do now is we're going to swab out the right ear first. You need to just make sure you get kind of deep into the ear canal and get a good sample. And then once you have it, you take the right side and you roll it. You do not want to smear it. You roll it because you don't want to crush the wax onto the slide. Then we're going to do the same thing with the left ear. And then we're going to roll this one onto the left side of the slide. So now, once once we have the air slide prepped, we're going to heat flame it and heat fix it. Make sure you don't melt the wax, but you want it to stay on the slide. So you can use a blow dryer or a lighter. We use lighter, so you just run it back and forth underneath the slide just a couple times. And then next you're going to stain your slide. So we dip it in each dip quick 10 times. The next thing you're going to do is rinse the back of the slide to get the excess dip stain off of the slide. And then after that, you're going to use the book to dry the slide. And you want to just pat gently so you don't break the slide and just get it as dry as possible. And then we're going to place it on the microscope. So now, once we have the air slide prepped, we're going to heat flame it and heat fix it. Make sure you don't melt the wax, but you want it to stay on the slide. So you can use a blow dryer or a lighter. We use lighter, so you just run it back and forth underneath the slide just a couple times. And then next you're going to stain your slide. So we dip it in each dip quick 10 times. Then you're going to wipe off the excess. Okay, and then the next. The next thing you're going to do is rinse the back of the slide to get the excess dip stain off of the slide. And then after that, you're going to use the book to dry the slide. And you want to just pat gently so you don't break the slide and just get it as dry as possible. And then we're going to place it on the microscope. Okay, so today we're going to be doing a fungal test on our patient Reggie, who is presented with a lesion on his wrist that has lost hair on the top of it. So the things you're going to need for this test is your gloves, your patient, you're going to need hemostats, and you're also going to need your DTM, which is what you're going to put the hair in to grow your fungus. So what you're going to do is you're going to take the patient and you're going to pull hair from around the lesion. And then you're going to place that in to the DTM. And then I'm also going to get a sample from around the edge of the lesion and any hair that's on top of the lesion. So after you get your sample, you need to place this in a dark space to sit for 96 hours. You need to check it every day for growth, change in color, growing anything. And then after that, we will check for the results. So the sample has been incubating for 96 hours, and as you can see, there is no visible signs of growth from our sample. We are still going to place it on the microscope and look under the microscope to check and make sure there has been no contamination growth or no fungal growth. So the things you need are you need your gloves, your hemostats, your slide, your lactophenol cotton glue stain, and your clear cellophane tape. So what you do is you just pinch it on the side, and then you're going to use your hemostats. And you're going to place it over your median, because you're trying to pick up where you were doing the growth. And then after that, you will set it aside, and you're going to place 1 drop of your lactophenol stain on your slide. And then you will place your piece of tape on your slide. It's going to act as the cover slip for your slide. So you'll just place it right on top. And then we're going to look at it under the microscope. You gotta make sure you use the lower power because this kind of stain can damage your microscope lenses, so make sure you don't have any contact with that. Our growth did not show any signs of. So now we're going to examine under the microscope. And you just need to scan your slide and look for any signs of fungus that might have grown. Once you're done looking at your slide under your microscope, you are looking for any types of contaminant growth, your fungus that's growing. Our sample is negative, so our patient does not have any fungus or contaminant growth. So today we have our patient Reggie presenting with hair loss. So we're going to do a skin scrape. So the materials you need are your slide, your mineral oil, and your blade. So we're going to take our blade, we're going to take it out. And then what you're going to do is add 1 drop of your mineral oil on the slide. And then take your blade, put it in the mineral oil. And then the area you're going to scrape, you're just going to pinch. And that is for if any mites or anything are on your hair follicles, it will bring them up to the surface. And then you're going to scrape in one movement, just until they start bleeding a little bit. You're going to take your sample and put it on your slide. And that's how you do a skin scrape. So once you've got your slide prepared from your skin scrape, you need to place a cover slip on it and you're going to look at it under the microscope. What you're looking for in a skin scrape is just for any type of mange, what type of mites they might have. So Demodex or Sarcoptic is the most common for the dogs. And then we're going to review our slide and see what's going on. So when you start looking at your slide, once you have it focused, it's normal to see hair follicles because you're wanting to scrape where the fur is. And then it's also normal to see some red blood cells because you did scrape until they bled. And then if your slide was positive, you would also see the mites depending on what type they had. You will also see skin cells on here. We did a superficial scrape because we were just looking at the hair loss that he was having, so we just did the superficial scrape. If you're doing a deep scrape, you will scrape deeper into the skin to look for other types of things that might be going on deeper into the hair follicles. And our skin scraping evaluation for this patient is negative.
Today we are doing a necropsy on a rat. First, you examine the outside and see if you can determine the cause of death. Position, and we'll make an incision into his thorax and his abdomen. And then you go ahead and look at the internal organs and see if there is any congestion or any abnormalities that you can see. We'll take a few samples of the liver and the spleen to send in and just make sure histologically they're okay.
after we did our necropsy, I'm just going to talk about kind of the PPE you need to wear. So you need to make sure you're wearing some sort of apron or gown to protect from any splatter coming from the patient that you're doing the necropsy on. Also a net, a hair net, a face mask, and gloves. This is protect you from any potential diseases that animal may or may not have. And then normally you would use a necropsy knife. We did a smaller animal, so the doctor just used a scalpel and a blade for that because our necropsy knife is too big for our patient. And then after that, we will dispose of our patient properly. We also take samples from our patient during the necropsy to send off to see what's going on. You just need to make sure those are properly labeled. So we took a sample from the liver. So I just wrote on the container liver, and then we'll print out the necessary things to send those off. And that's how you do a necropsy. So today we're going to be talking about rabies suspect handling. So the first thing is people who are vaccinated are the only personnel allowed to handle the suspect. If you do not have the vaccination, you cannot handle the patient. The next thing you're going to do is if we are sending off a specimen, you need to make sure you have the appropriate PPE on, which includes gloves, any sort of gown or apron, a mask, and eye protection. You want to protect yourself from any type of blood or any type of stuff that comes out of the specimen while we're doing the surgery to get the specimen that we need to send off. The next thing you do is make sure you wash your hands thoroughly after you collect your specimen. If you're going to be sending your specimen off, you do need to double bag it in an impermeable bag. So you put the specimen in, you tie it tightly, and then you put it in another bag and tie it tightly. You store it in the fridge if the health department is going to come pick it up. But if we're going to be sending it off, you need to put it into a cooler with ice packs. You also need to put it into another box with the correct labeling, and then we will ship it off to the place that it needs to go to. Here in Texas, we send it off to Austin. And the next thing you need to do with the body that's left over, you also need to double bag it. We will store it in the freezer until we get the results back. If it is positive, you will also need to ship the body out. If it is negative, we can decide if we're going to cremate it or not. And that is rabies suspect handling. So today we're going to be doing a vaginal cytology. The first thing my co-technician is going to do is she's going to clean the vulva with sterile gauze and sterile saline. Once she finishes that, then she'll take the swab, but she's going to do it with her left hand because she's going to be getting the swab with her right hand. You also need to make sure you don't let the tail go back down and cover the vulva because then you're recontaminating it. So you need to make sure you get a sterile swab, and you're going to pull down on the vulva just a little bit and insert it at an upward angle and get a small sample. And then you're going to roll it onto the slides. You do not want to smear it or you can damage the cells. So you're just going to roll it onto each slide. And the biggest thing is to make sure everything is sterile. So you're going to be using sterile gloves, sterile gauze, sterile saline, and a sterile swab. And after she finishes rolling onto all the slides, the next thing we're going to do is going to let them dry, and then we're going to stain them and read them. So now that our slide has done drying, we're going to stain it with our 3 stains. So you're just going to leave it in there for about 10 seconds per stain. So you're going to use your light blue stain first. You just want a steady stream of water because you don't want to rinse any of the cells off of it. And then we're going to let this dry, and once it's done drying, we will read our slide. So once our slide has finished drying after the staining, we're going to look at it under the microscope. You're going to start out on the 4x power to focus your microscope, and then you can go to the next power. We'll probably stop at the 10x, so you should be able to see everything you need to see on your 10x power. So once you've got it focused to where you need it, you can change your microscope power. And then as I scan this slide, we're going to figure out what stage of estrus our patient was in. So there are 4 stages of estrus. The first one is anestrus. That one you're going to see mostly intermediate and parabasal cells. You will also see red blood cells and neutrophils. In this stage, the female is not receptive, and most of the time the males are not interested in the females. And then the next stage after that is going to be our proestrus. In this stage, you are also going to see a mixture of intermediate and parabasal cells, but you're also going to start seeing your superficial epithelial cells. And then in this stage, the males are interested in the females, but the females are still not receptive. You shouldn't see much more neutrophils or red blood cells in this stage. And then our next stage is going to be estrus. This is when our females are receptive to the males, so they can get pregnant. In our proestrus phase, it is not recommended to breed. It can happen, but it's not recommended, so it's recommended to know when they're in estrus, so you can breed during that time frame. That's going to be your most successful time for breeding. In the estrus stage, you're going to only see the superficial cells, and they're also going to be keratinized. You're not going to see any neutrophils, but you may see some red blood cells and some bacteria. And then our last stage of estrus is going to be diestrus. And this is going to look a lot like our anestrus stage, so you're going to start seeing your intermediate and your parabasal cells again. You may not see any bacteria, and you're probably not going to see much red blood cells or neutrophils. And also at this time, our female is going to be showing no signs of being receptive, and the males are also not going to be interested. So that is our reading of our vaginal cytology, and in this one, our patient was in proestrus. So today we're going to be doing our cross-matching autoagglutination test. So your materials that you need are your sodium chloride 9% saline solution. You need your 2 red top tubes for your donor and your recipient that have been spun down, so you have the serum at the top. You also need your 2 purple top tubes for your donor and recipient, for also spun down for the plasma at the top. So the first thing we are going to do is we are going to take the serum off of our donor and recipient, and we're going to add it to our 2 new tubes that are labeled donor and recipient serum. So once you have those 2 separated into the 2 separate tubes, the next thing we are going to do is we are going to decant the plasma off of both of our purple top tubes for our donor and our recipient. And you're just going to throw away the plasma. You don't need to keep it. So you're just going to decant it. You need the red blood cells. We're going to do the same thing for the donor. Like I said, you're just going to decant the plasma. You're going to save the red blood cells. Alright, so the next thing we're going to do is we are going to wash our red blood cells. So we are going to place 2 drops of our donor and our recipient's red blood cells into 2 separate tubes. And then we're going to use our 9% sodium chloride saline wash, and we're going to wash our red blood cells. So the first thing I'm going to do is place the 2 drops. And then we're going to use 2 drops from our recipient. And the next thing we're going to do is we are going to fill up our red blood cells with our saline solution. This is just so we can wash our red blood cells. And then we're going to centrifuge them for 1 minute. And then after that, we will repeat that process 2 more times. So once our red blood cells are done spinning in the centrifuge, you can kind of see this is what they look like as they had been washed. So what we're going to do is we're going to remove the clear liquid, which is the supernatant. So we're going to remove that for our donor and our recipient. And then we're going to wash again. So now after we have washed our red blood cells 3 times, so I'm going to decant the supernatant 1 last time, and then after that we will make our suspension. We make our suspension by placing 0.02 mils of our red blood cells that have been washed into 0.98 mils of our saline solution. And then we have those labeled test tubes so we know our donor and our recipient suspension. And then we will make our minor and our major cross match. Okay, so now that we got the supernatant off, what I'm going to do is open both of our suspension labeled tubes. And like I mentioned before, I have 0.98 mils of our saline solution pre-measured out. So I'm going to place those into our suspension tubes. Now what I'm going to do next, like I said before, is going to get 0.02 mils of our red blood cells. It's a very, very tiny amount. So I will show you once I get it drawn up. So you can see here it's a very, very, very tiny amount. So this is our donor one, so we're going to place it into our donor suspension. And we'll do the same thing for the recipient. Okay, and we're going to place it to our recipient. And next we are going to make our minor and major cross match. So you're going to need your serum that you pulled off of your red top tubes from earlier. So we'll go ahead and open those. And you're also going to need the suspensions. So for our major cross match, what we're going to do is we're going to take 2 drops of our recipient serum and we're going to place that into our major cross match tube, and then we're going to get 2 drops of our donor suspension and place that into our major cross-match tube. Okay, so we'll get 2 drops of the serum. And then we're going to get 2 drops of the donor suspension. And we're going to place our cap back on. We're going to mix gently. And then for our minor cross-match, what we're going to do is get 2 drops of our donor serum and add 2 drops of our recipient suspension into our minor cross-match tube. Okay, and then we will also mix this gently. So we made our minor and major cross match, so we also need to make a donor control and a recipient control. And to do that, we're just going to place 2 drops of the donor suspension and the donor serum into one tube. And we will do the same for the recipient, but with the recipient serum and the recipient suspension. And you mix gently. And then what we will do is we will let these incubate for 30 minutes, and then we will centrifuge them for 1 minute, and then we will look at them under the microscope to check for autoagglutination. So all 4 of our vials are done spinning. They spun for 1 minute in the centrifuge. So if you're looking at them visibly, you don't see any agglutination, but what we're going to do is microscopically look at them to check for it under the microscope, but visibly or macroscopically you don't see anything. So based off of this, they would be fine for a cross match, but we'll look under the microscope. So we're going to set our controls away, and we'll put 1 drop of our minor onto a slide. And you do not stain these. And then we'll put 1 drop of our major cross match on a slide. And then you're going to start on your low power, and then on the 4x, and then you can go up to the 10x. So we will go up and focus it. So what you're looking for is all of your red blood cells to be dispersed and not overlapping. So once you get it focused, you can go ahead and go to your next power. So according to what I'm seeing on the microscope, all the red blood cells are dispersed appropriately. They're not overlapping at all. They all look evenly dispersed. So for our minor cross match, there is no agglutination present, so this one would work for a cross match if the major is also has no agglutination present. So what we're going to do now is scan over it real quickly. Everything looks good. So next we're going to look at our major cross match, and if this one has a no agglutination as well, then we are all set to go. So start at your small power and adjust it to where you can see all the blood cells. Once you see everything, go ahead and change your power, and you'll have to readjust. Go ahead and look at everything. So according to our major cross match slide as well, none of the cells are overlapping. They all look evenly dispersed. I do not see any agglutination present. So that means both of my donor and my recipient would be good for a major cross-matching blood transfusion.